So for our next presenters, just so that they can invigorate your thoughts, you guys get 2 in 1, actually. So we have Sally Modystach and Deborah Davidson joining us to present a little bit about how the built environments can help promote health and well-being. So within their duo, Sally is the Director of Healthy Environs, which is a sustainability and community well-being consultancy. Her work focuses on promoting healthy communities through projects and partnerships at the local level. Sally actually has a master's in public health and also has worked with like government health organizations, things like that as well. So brings a unique perspective to this. Deborah is the director and also an ESD consultant for dsquared Consulting. She has over 15 years of experience in this area, so brings a lot of wealth of knowledge across a broad spectrum of sustainability. She's currently working on projects that combine energy efficiency, indoor environment quality, and well-being across many different sectors. So please welcome Sally and Deborah up to the podium, and looking forward to your thoughts.
Okay, thanks, Ken. So I suppose as Ken highlighted, my background's in public health. I've also worked in environmental sustainability in local government in previous roles. More recently, I work on projects, on health promotion related projects really. So I'll be going back into some sort of public health principles which, hopefully reinforce the importance of what we're talking about today. So I'll be taking you through some, I suppose, common concepts in the public health profession, but I think it's really important that we talk about these concepts more broadly, and they're very relevant to today's topic. So in public health, we commonly talk about the importance of addressing the social determinants of health. And this is really a recognition that our health is a result of our environment, the economic conditions that we live in, and the social conditions that we live in. And this is widely recognised by public health professionals and medical professionals. And I suppose hence, we understand that the health sector continues to play obviously a fundamental role in health treatment. But when it comes to promoting wellness, we really need to be working sectorally across a range of professions. So there's a range of internal and external factors that impact on our health. Noise pollution, our weather and climate, urban design, our interactions with other people, trauma or accidents we may have been exposed to, workplace hazards, pathogens that we may be exposed to, the healthcare interventions that are available to us, and of course environmental contaminants or toxins that we're exposed to. So this is a diagram produced by the Australian Institute of Health and Welfare, just to reinforce that really our health is highly influenced by our environment. So as I said, health professionals increasingly recognise that many sectors have a role to play, and I think we're already starting to do this, is really integrate health and wellbeing and health and wellbeing considerations into a range of professions. I suppose we've traditionally had a health protection focus. My initial role out of university many years back was as an environmental health officer. So really my focus was on health protection. But a range of professions have a role to play in health promotion, urban design, building design, architects, a range, the list goes on. So to address public health, we need to have an understanding of what are the health challenges that we're actually facing. What are the actual chronic disease patterns that we're facing? And these are the 9 national health priorities that have been released by the Australian Institute of Health and Welfare. And what I suppose we're recognising is that the health challenges of the early 20th century of protection of ourselves from infectious diseases needs to continue to be a focus. We need to continue to protect ourselves from communicable and infectious diseases. Rob's an expert in communicable diseases, and we can't lose sight of that. Continues to be a threat. But the disease patterns are changing, and now what we're experiencing is more lifestyle related chronic diseases because of chronic disease risk factors in our community, and mental health and well-being, and the issue of depression is also a significant health issue in today's society, and that's recognised by the World Health Organisation. So our 9 national health priorities are cancer control, cardiovascular health, injury prevention and control, mental health, diabetes, asthma, arthritis and musculoskeletal conditions, obesity and dementia. And I'm sure the Australian Institute of Health and Welfare will continue to review those priorities based on the health patterns within Australia. But we're also now talking about well-being, not just health, but recognising that we need to be focusing on keeping people well. So this is from the Martin Seligman, who I think was a previous Thinkers in Residence presenter in Adelaide, and he talks about the PERMA theory of well-being, and the fact that for good well-being we need to be experiencing positive emotions, we need engagement, good engagement with other people, we need positive relationships in our life, we need meaning in our life, and we need a sense of accomplishment. So why do healthy indoor environments matter? This is Deb. It's not me. I have to get a better image off dsquared, but that's the dsquared office. It's generally recognised that Australians spend 90% or more of their time indoors.
Not me. I'm not always.
So I suppose whilst I come from a health background, I'm really interested in this topic because I just think the feeling of the spaces that we work in has a big impact on the way we function and our health and well-being overall. And I just find it really interesting, like I reflect on my initial role as an environmental health officer, and health protection has continued to be an important element in design. Our access to safe, affordable and sanitary housing is a key determinant of our health, and that is widely recognised by the health profession. And I suppose historically we've had standards through legislation, regulation, Australian standards that are really focused on health protection. So how do we ensure that commercial and residential premises are built to ensure adequate indoor air quality, control moisture and mould growth, which is it's significant consideration for people who experience asthma. We need to ensure potable water quality, minimise harmful chemical exposures. We need to look at the use of the building, and sometimes health hazards are introduced if the building hasn't been designed for the right use, and so change of use is an important consideration. How do we manage that? And we have issues such as Legionella control. How do we actually cool our environments? So we've had an illness prevention focus, and that needs to be a continued focus. But the World Health Organization is also recognising emerging public health challenges associated with increased energy costs and climate change. So the issue of energy poverty and how this is going to impact on lower income households is an issue recognised by the World Health Organization. So, as Ken mentioned this morning, I suppose what the Living Building Institute is really about is promoting good health. So we're moving towards indoor environments needing to promote wellbeing and good health. And this is what Deb will elaborate on further. So the design can play a role in our nutrition, our social connections with others, our level of fitness and activity, our comfort, and our overall mental well-being. So I'll let Deb elaborate on that.
So wellness, is it the new sustainability, is the sort of question that we're all looking at this morning. I arrived in Australia, it's like 15 years ago now, just after the Sydney Olympic Games, and sustainability was definitely the buzzword at the time. Everyone was talking about green and green buildings. But there's definitely, as Sally was just saying, some parallels with the health industry where it was mainly about prevention and protection of the environment. I think over the time that I've worked in the industry, there's been so many successes in buildings, and most of us here in the room are pretty aware of how that's gone. From basically having sustainability wasn't even in the building code to having it really fully integrated into buildings. We've then moved on towards sustainable communities. So Ken talked this morning about the waves of sustainability. So you could say that the first wave was where we've got to so far with looking at buildings, and that the second wave potentially is wellness and making people the centre, looking at how we can promote and enhance people's well-being. Some people might say that sustainability always had people at the centre, and that sustainable outcomes for people were always part of sustainable buildings. This slide just shows us some of the ways in which sustainable buildings really benefit people. There's quite a lot on there, but basically we heard earlier as well from Darren that views to outside result in increased patient recovery time, better memory function in schools. Daylight, access to daylight has proven improvements in productivity, and access to sustainable systems result in productivity benefits as well. Even as far as retail sales are actually increased in areas that have access to better daylight, and some of the big corporates from around the world are using these stats to their huge benefits in terms of linking it back to money and making more money out of sustainable spaces. This slide does talk a little bit to how we can quantify the economic benefits. This is actually taken from, I think it was one of the City Switch slides around, and it's not referenced on there, around a study that was done into a 4.5-star neighbour's office, where there was a quantified reduction in energy consumption, which resulted directly in a saving in the ongoing energy bill. That's the number at the top, $18,200 per year. But if you look down to the number at the bottom, you can see a phenomenal number from the increase in productivity. So basically, buildings can enable better health and well-being, and there is a quantifiable business case for it. It's actually getting the numbers and the proof that around the productivity and the well-being is the challenge going forward. But in terms of trends at the moment in sustainability, there's a McKinsey report recently that said that health and well-being is the next $1 trillion industry, and I think we're seeing that everywhere in life. A phenomenal increase in the number of Fitbits and fitness-type devices is really interesting. And designing for health, well-being, and productivity is definitely the next big trend in the sustainable buildings world as well. And this, I suppose, is an image of how they collide. So we're talking about green buildings coming together with wellness. As a result of that, there are actually partnerships now forming with the various tools that some of us will know around sustainable buildings. The Green Building Council have recently signed an agreement with the Well Institute, and I'm going to talk a little bit about the Well Building Standard and how we could use that in some of our projects. The Living Building Challenge fits into this as well, and there's many of the petals related to health, beauty, and equity that we'll discuss later that cross over with these tools as well. So the WELL standard is a sort of relatively new rating tool or design standard that's come out around this designing specifically with people at the centre of buildings. It's a tool. You can have your building assessed and come out with a rating, and it has these categories that are looked at. So we've got air, water, nourishment, light, fitness, comfort, and mind. Some overlaps with what you might think about in terms of normal sustainable building design, and definitely moving into some new spaces there with the likes of nourishment and mind. You can, back to the usual, thankfully it's not star ratings, you can get silver, gold, or platinum, and it is a tool that goes right through the construction process. So it goes through design, construction, and then on to ongoing occupancy. And it is a performance-based tool, so it looks at how you actually perform in the building. The standard itself is freely available to download from the internet. It's quite a big document, but it has some very interesting things, and they've gone about using the sort of simplified graphics of the human body to sort of try to illustrate how design changes that you're looking at in the built environment affect people and their bodies, and these change as you go throughout the tool. So with air, we're really talking about access to fresh, clean air and removal of toxins. Now, you might think access to fresh air isn't a problem for us, but the air inside buildings is generally, especially older buildings, is generally 2 or 3 times worse than the air that is outside. So it's still important even for us here in Australia. Water, again, is talking about access to fresh water quality, but also making sure people are adequately hydrated. Dehydration does actually affect memory function and therefore productivity. Nourishment, we've got things like access to fruit and veg, and I suppose this can be taken into your office environment by thinking about like vending machines that have fruit and veg rather than fast foods. Also covers light, and there's a few there that we would think about in terms of normal green building design. It's prioritising daylight views, but also looking at how we, because we spend so much time indoors, how can we make the indoors as much like the natural environment as possible. So you've got looking at lighting solutions that actually match your circadian rhythm and go up and down throughout the day. Fitness is a big one. It can be as simple as encouraging people to use the stairs. And to me, I think this one is really about using buildings to enable changes in behaviour, so that people think about fitness when they're in buildings and also then throughout the rest of their other activities in their life. From a comfort perspective, we're also looking at all of the ways that you feel physically, emotionally comfortable in a space. And on the mind side, we're looking at the cognitive and emotional health, things like sleep policies in there. I think Ken would probably like it if we had a sleep policy in our office so we could have lunchtime naps. So the tool is designed really to be a design guide. It's as I said, it's free to download. The actual going through the registration process of WELL and actually getting a building certified it depends on your scale of building. It can cost anywhere from a few $1,000s up to tens of thousands of dollars. So it's not necessarily a very cheap exercise. But there's nothing to stop you using the concepts that are in the tool in our daily life, in the way that we work in offices, or if you are in the design and construction industry, in the construction of new buildings, or looking at how to improve existing buildings. This is the first WELL-rated project in Australia. It's Mirvac's head office in Sydney. I think it got the rating a couple of months ago. They actually also, in this building, have a living lab where they're actually testing the benefits on people. So out of this, they hope that they can start to more accurately quantify some of these improvements in well-being and productivity, reduction in sickness and absenteeism, and how the investment that they've made in the workplace is actually benefiting the people who live there. I think I'm on my last minute. I've gone over. 14 seconds, wow. Okay, so I was just going to say, this is the sort of slide that I've used for a long time. This is a place where I've definitely worked before, and I think most of you have probably worked that sort of stuffy, horrible environment where you feel like you don't have access to fresh air, you know, you're stuck in the corner cubicle, you don't have any access to daylight or views, and you think about how that makes you feel compared to integrating some of the ideas that we've heard about today in terms of biophilia, permaculture, wellness, well-being. I would certainly work better in a place that looks like this. And I think it'd be really interesting to hear the discussions about how we move towards buildings like this. Thank you.